Welcome everyone to our virtual Venture Cafe Thursday gathering on AR, VR, and 3D simulation and training. We are going to kick off our first panel of today with Suli Koo, who will be our moderator for this panel. And Suli, I'm going to give it over to you.
Thanks so much, Jamie, and welcome everyone. Thanks for Innovation Studio for giving me the opportunity to moderate this amazing panel. Thank you to VinciVR, Nextech AR, and IKONA Health for being our amazing panelists. I'd love to start out by having you introduce yourself, your company, and how and why you formed the company. So I'd love to start out with you, Eagle Wu from VinciVR, please.
Thank you. My name is Eagle. I founded and currently serving as the CEO of Vinci Virtual Reality. We started a company to lower the barrier of entry to create more VR training content. One big issue with getting VR content out there is that it's really expensive and time consuming to make. So we're trying to chip away at that and make it more accessible.
Thank you. Tim, would you like to go next?
Absolutely, I sure would. Hey everyone, Innovation Studio, thanks so much for having me. Really good to see you again. My name is Tim Fitzpatrick. I'm one of the co-founders and the CEO here at IKONA. I started IKONA almost 4 years ago Saturday, because of a personal need. So I was 7 years in the Navy, my last 2 years as a VA patient in the hospital. And when I healed, I realized, hey, that was a terrible patient experience, that should change. I spent a couple of years in finance here in New York, and then decided to found IKONA about 4 years ago. And we initially started out using a randomized controlled trial we conducted for perioperative education with VR services to help patients understand what they were up against when it came to surgery. And we quickly started to realize our application was actually best suited in dialysis with patients who are understanding their treatment options. So we are now fully in the kidney care space. We use VR as one of our tools for helping patients understand their treatment options. And we are an education company powered by learning science and storytelling.
Love that. Thank you so much, Tim. And so just for the audience to know, I found out about VinciVR through another amazing network partner, See Ahead. Tim and I met through the AR and VR Health Association, but Tim has ties to Rhode Island as well, so we'd like to come and host you and would love to see you here. And of course, Janice Dru, the final panelist, is a Rhode Islander working for Nextech AR. So you are up next, Janice.
Absolutely, and I remember going to the River meetings with Suli, and you know the VR space in Rhode Island has blossomed with your involvement as well. And I just joined Nextech AR in December of last year. The company is relatively interesting in that it's a publicly traded company headquartered in Canada with teams in California, Georgia. We're growing here in Rhode Island, and it is a tech stack that it's brought together with augmented reality, delivering experiences for virtual events, for online education and learning, as well as for e-commerce and advertising. So it's in a number of different spaces, creating multi-device with your computer, with web AR, as well as with your phone, with app-based AR. And I know today's focus is on 3D training. And I do think I really align with the company's vision and mission, which is to create infinite experiences that inspire the world. And our mission is really to pioneer immersive technologies that allow people to achieve a better future for the world. And so I think a mission-driven company is always one that I really align with, and we're really looking to create a sustainable future with technologies.
Wonderful. Thanks so much, Janice, and thanks for bringing Nextech AR to Rhode Island. You know, as many of you who have followed VR know, VR and AR has continued to make progress. All of the large technology companies are making bets in AR and VR. But in terms of applying it, it's really made leaps and bounds in training, especially progress. So VR, AR used in the right situations really do result in better learning outcomes, less expensive training in the right situations, and also can reach a wider audience. So, you know, I'm going to start out with some panel questions. So Eagle, when we talk about VR in the industries that you target, how does VinciVR apply VR, and why does it work in the situations that you use it in?
Yeah, so it's a really good question. Well, the science behind why VR works is on how people remember things, more specifically, how we actually forget the things that we're supposed to remember. So a lot of psychologists have found that, within 1 month, about 4 weeks time, if you don't actually practice realistically some of the stuff you're taught, you will actually forget about 90% of what you learn. That's a lot. It's pretty close to 100%. So, if you're training a workforce and, let's say you don't have access to certain equipment, uh, and you can't train someone within that 1 month time frame, which especially for large enterprise companies could happen and does happen quite a bit, you're putting your workforce at risk essentially. So where we found our niche really well is in where we're focused on, or actually are in the defense space and the renewable energy space, specifically with offshore wind turbines. So things like defense, some things like combat, for example, you can't shoot at someone, right? That's usually not advised during training. So having something like simulated training for that experience, giving people exposure and making sure that they can remember what they're taught during that exposure. That's one part of making sure they remember what they need to remember. And then for things like, for example, the offshore wind space, there's currently in the US, there's no offshore wind turbine. I mean, we've got a few off block islands, but that's pretty much it. So if you want to train workers across the country and you don't want to keep flying everyone to Rhode Island, your next best bet is making a VR version of that turbine and giving people access and letting them train and get hands on in VR. So that's kind of where the use cases relate to, experiences and training that is just not advisable to simulate in real life, like combat, or it's just not physically feasible to set up the infrastructure to get hands on. So, like the wind turbines in the US.
So
Yeah.
we could actually reduce the amount of shooting that happens because people are able to calm down. And do you see that there's an actual calming effect because we talked about confidence, right? You don't
Yeah.
have confidence in a situation, you may react differently.
Yeah. So actually, one good example is actually in a wind turbine. We've seen this happen a lot. So a wind turbine is a fundamentally hostile environment. Pretty much because it's very new technology, right? Let's face the fact: renewable energy is fundamentally a new industry. So a lot of the things in a wind turbine are you have to be very careful, basically, or else you can pretty much die instantly. So a lot of the trainees, they're taught through PowerPoint. If a fire happens, this is what you do, but they don't actually walk through any of it like realistically. So what the industry has seen is if an accident like that happens. So let's say a fire breaks out down tower. A lot of trainees just forget their training. They lock up, right? They forget, like, it's like all the years of training just went right out the window. And it happens more often than not. And that's usually when people, if you start forgetting your training, that's when you start getting casualties. So by giving them that exposure early on in a virtual environment, it's not going to be 100% realistic, right? But it is something. It's 80%, 90%. The more that we can lower the probability that someone will lock up or freeze up in the real life, God forbid they face that kind of situation, the more people we can bring back home.
Yeah, no, that's a really good point. Just the lockup prevention and coordination too, right? Coordination between people. If folks don't know, the Surface Warfare Officer School here in Rhode Island has many VR and full room simulations, and they do find that the more we can get folks through simulations, the better they are the first time they hit the water. So VR in the right time for the right situations can be very, very helpful. Now, it's not just about these super very dangerous situations. I would say another place that I need confidence is in health. And although I'm not your target market, Tim, I'd love for you to talk about how IKONA Health helps build confidence.
Absolutely. Yeah. So your point about the Navy simulators, I can't tell you how much time I spent in simulators, and it made the biggest difference. Before you could see a plane, you have to spend thousands of hours in a simulator. So there's a good reason for that. Eagle's point is a fantastic one about forgetting. That's in fact where most of our attention is at IKONA. We know that patients have a lot going on. Stress reduces your cognitive capacity to understand materials. Literacy often is not where it needs to be health-wise. Very rarely taken into consideration with existing tools. So forget about VR, AR for a second. Education in healthcare is terrible, and it's not designed for patients. So what we can do is to ask the question, what frameworks can we put in place that make this better? And where would AR, VR exist in that framework? And some of the steps we've taken at IKONA are built by learning scientists. So the very first person I brought on board spent his 30 years in academia. He was professor, head of the psychology department at Texas, now in his second career with us. And he spent his career in a lab studying how the brain is wired to learn. And his research is very much in keeping with Eagle's point of people are wired to forget. And that's critical to understand, because until you understand how we're wired, you can't optimize for reducing the amount of forgetting we do. So when you look at that with patients, we take a three-step approach. The first is identify the learning task you want a patient to understand, or a healthcare provider for that matter. Learning task might be a bit of information. Where are your kidneys? How many do you have? Why are they important? That's great. That's what most of healthcare information is. You don't need VR for that kind of thing necessarily. The second piece is confidence building. Suli, your point, right? This is more kind of anecdotal, emotional, experiential. This is storytelling, what to expect during surgery, what to expect with this treatment option. The third type of information is motor skills and behavior. So if you're transferring skills, that's Eagle's world. That's where you need to figure out how to scale a device that is really hard to do, and how do you get it in the hands of people who don't really have access to this, and not give them a piece of paper where they have to transfer and translate a 2D representation into a 3D representation in their mind, and then somehow figure out what to do with it and then put it back on paper. It's too tall an order for your brain to do. So our step is, first, what is that type of information? Second, which brain region is going to be responsible for doing that task? And then third, which technology mechanism is wired to target that brain region? So for motor skills, that brain region is determined by something that VR is great to address. It engages the entire brain. You really can't separate it meaningfully between a real lived experience and what you're seeing in the simulation. And for that reason, it's going to stick longer, because you're not just overloading your prefrontal cortex in the front of your brain. For behavioral centers and emotional centers, you see a lot of empathy building in VR. You see a lot of storytelling, what we excel in, hearing from other patients, being transported into their homes. That's a VR problem. That's a 360 interactive video problem, which does it much more effectively, we've studied, than 2D video. YouTube, there's plenty of stories online, but imagine putting a headset on a patient and having them transported into the patient's home and having a one-on-one conversation. And now all of a sudden they can imagine themselves as their future selves, and they're making decisions about treatments based on that scenario. And then perhaps you don't need all of that technology, or AR is a good solution. It always comes down to do the 3 steps, understand what your best tool is for that, and in healthcare specifically. And now you can start thinking about, what kind of access do we have? Do people have these devices? Is this an enterprise sale? How many organizations can possibly use this? How complex is the clinical workflow? Do we have the labor force to support this? What does usability look like on the end users? With brand new technologies, it's very, very difficult to account for mobile health literacy or anything beyond mobile health literacy. We're just starting to understand that most people actually have a pretty good grasp of their phones. That's important. That's very important, especially as you think about the type of tech to match up. So that's my long answer to confidence, Suli.
No, that's really great, Tim. So, I did look up the forgetting curve because you mentioned that in the beginning, and Eagle
Yes.
mentioned as well that, in traditional training, we forget about 50% within the first hour. I had no idea. And that reinforcement is really, really important. And then to recap, you talked about using VR with IKONA Health. I'm sure that there are settings where you're able to deliver that VR setting and to reinforce perhaps what patients have just heard. But then it sounds like you're also using mobile and perhaps AR to augment that and to reach more people. Am I saying that correctly?
Yes,
Yeah,
you
okay.
are. I'm glad you brought this up. I'm glad you kind of brought me full circle, because
Yeah.
the whole point and IKONA's mission is just the one-liner is to launch 10 million personalized learning journeys over the next decade. And all that means is for every single patient, they have a unique journey they should go through based on their personal inputs, preferences. What time of day do you like to learn? How do you like to learn? What sort of treatment options are you going through? What is your care plan? And in every single instance, whether it's with a care team or between those visits, there should be a consideration made about how much do they understand today? How confident are they about their current plan? How anxious are they feeling? What is their mental health assessment saying? Are we doing any motivational interviewing? All of that should be in the education roadmap, believe it or not, because without it, and unless you are personalizing every single interaction from an education standpoint, you're going to miss out. And there's going to be a gap between care coordination. So for us, just one quick example of this in practice. If you look at dialysis patients who are in center, most patients, unfortunately, are crashing onto dialysis. So kidney disease is called the silent killer. It's the 9th leading cause of death, but it's because so few people understand it. There are very few symptoms. And when it's too late, stage 5 and stage renal disease, you can crash, end up in the hospital. You're told you need dialysis. You go to these brick and mortar centers 3 times a week, 4 hours for each visit. And you have options, but it can be pretty overwhelming to think of, well, it's kind of, I'm used to coming into this center. This is now part of my life. It's not great. I'm not enjoying this, but it's part of my schedule. Well, they have an option to go home. For some patients, that is a better option. Flexibility, if they're younger, they still want to work. You have more flexibility typically with options at home. How do you get them over those fears of going home? You do it through VR, through storytelling, through showing them they can do this, building some sort of confidence. And that can't be done. They've been struggling for years to do this without VR. We inserted VR, we tested it, and it's happening at rates they've never seen before. So it's really about using the power of a new medium to its advantage, and not for everything you can possibly use it for.
That's amazing. Thank you so much for talking about that specific example, Tim, because I can imagine, and I know, Amy, you put in the chat, there are so many things about growing older, growing up, where you don't get to try those situations beforehand. There's a lot of fear and anxiety and unknown, and you may not have the people to talk to or available to talk to. So there is really nothing like experience, and that VR can bring that confidence. Thank you. And then I'm gonna also segue. We talked about AR to Janice, how really VR and AR give us a multimodal kind of tool belt that we can use in training. And Janice, would you tell us a little bit about how you're using AR for training at nextech?
Absolutely. And like Tim said, there's different ways of training that work well, and adding on AR is an additional way, whether it's AR where you're experiencing something in your own space with a immersive learning experience, or it's fully a headset with VR. There's different ways to learn. And I think with augmented reality, one of the key differentiators is that we are seeing wider adoption of AR because you don't necessarily need a headset. And I saw, if anyone was in the earlier session, talk about web VR as well, where you don't necessarily need a headset to experience a VR or an AR learning model. And with our technology, as an example, we started out with video broadcasting. So being able to reach 650,000 people at once, the video broadcasting is being able to reach people with video. The AR, now we anticipate that 80, 90 million people with AR enabled smartphones in the US. And as more and more smartphones come out, more and more people will have access to AR experiences. And as an example, we have built out all the first and second year lab science courses for Ryerson University, where you can drop a microscope into your own space and see what's in the slides, or dissect a rat. And the system is connected with the learning management system and will tell you if you're doing it correctly or incorrectly. And you can do it 100 times and not kill 100 rats, which is also a wonderful thing. I think I like to say our technology helps save lives as well. And from the healthcare perspective, we have a model of a diabetes pen as another example that shows you how to really put it together. And a video and a 2D experience may not be able to really show you how it works. So being able to have an AR model that you can drop into your space and interact with can really produce better outcomes from a training perspective. Oh, and you're muted, Suli.
So sorry, Janice. Yeah, so you talked about the medical piece as well as the entertainment piece. Is that right? Are there any other industry examples that or specific? I know you had talked yesterday about a hologram.
Yes.
I don't know if you wanted to show that.
Yes, I can show you. And what I'm going to do is I'm going to share my screen shortly. I have a QR code behind me. If you have an AR enabled smartphone, an Apple or an Android, you can scan in that QR code and put me in your room with you. And I have a little demo that I'm showing you some artifacts in my house. It's a museum example of how you can showcase a product or an artifact. So that, and I have a video of it as well that I can play. It's a 2-minute video. And I'm going to show you some web AR examples. So give me 1 second. I'm going to pull up my screen. This is our nextech e-commerce site. This is another thing where if people are interacting with products with a 3D model, they're much more likely to click on and buy that product. And if you were looking at this page on your phone, you click on it, it'll actually say, see it in your space. So you could be seeing the shoe in your space, put your foot in it and see how it looks right on your floor, spin it around, zoom in on it. This is the web AR example. And then add it to cart and just buy it right there. So if you like it, these are examples of web AR products that we've developed. And this is actually at a very low cost and affordable we also have an ARtize 360 app, which allows you to scan in your own object, send us an object, and we put it right up on your site and connect it with Shopify. So this is a great kind of small business use case and large companies too can create 3D models and start selling it there. Or seeing things in your own space with web AR as an example. We also are building out the first AR ad network. So this is an example of an ad where if I click try them on, it'll ask me, can you see? And I'll allow it, continue, and then it should capture my face. And then I should be able to see it, make sure your face is fully visible. I'm not going to go through the whole demo there because I'll let you guys try. Clearly.ca is the website where you can try on your own glasses. And some of you may have seen that already. And this is the hologram experience where if you were to download that QR code, it would say move to find surfaces, you place it, and then I start talking and explaining it to you, and you can make me larger and I'll talk to you about the boots, and there's a 2D picture of an art piece next to me that I pick up. So, and if I really wanted to, I could also throw in a 3D model of the boot that you could spin around on top of my human hologram. So this is a 2D recording that's overlaid into your space. And if I were to walk around, I continue to look at you. So it's a way to kind of put a full body person into your space for a performance or for a presentation, for training, for education, or for just kind of selling a product. We also have done job fairs. So our virtual platform kind of creates a 3D booth experience where you can drop a booth on your monitor and then have a side Zoom conversation while you're exploring a 2D platform. So kind of that 2D plus 3D model experience. And this is an example of you know, the core, what the course looks like. It tells you to experience the full AR Ties interaction, you do need to have the app. And if you can't download the app, we create a video of the experience where it shows you this is how you would drop a peptide into your own space. This is what the peptide looks like. If you were to scan it in, and it's taking a second to load here. But you kind of saw the picture with my experience. I think right now with Zoom and the video, it might be a little slow. So I'm not gonna.
That's great, Janice. Thank you. No, but I between this and what Tim started talking about, I think a good next question might be, who is your ideal client? And that kind of segues into the, you know, what industries do you serve as well? Yeah, can you talk a little bit about who your ideal client is?
Absolutely. We are working with a lot of event planners to build out events. So thinking about the last screen I just shared with you was Ryerson's Convocation. And so events that have at least 1,000 people and or 50 sponsors, or want a highly broadcast, you know, highly well done broadcast production that might also incorporate AR experiences. We have a whole platform for events. So anyone planning a big event, I'm happy to talk to you. Anyone who wants to create learning experiences, we have a higher education, you know, model that we're working with a number of colleges to build out courses. And then also in the e-commerce and advertising space, if you're looking to build out 3D models, those are kind of the three main categories.
Great. Thanks so much, Janice. Tim, could you answer the same question? Because I know you have multiple ideal clients. Last time we talked. Okay.
Yeah, we do. It's mostly in healthcare, but I will say we're healthcare applications we're learning are fairly ubiquitous, right? So that on the one hand, we work with healthcare providers, so your typical organizations who are providing care, health systems, large dialysis organizations, care providers, primary care physicians, that sort of thing. On the other hand, we're also doing work with the federal government, so the Department of Defense, National Institutes of Health, National Science Foundation, always looking for ways to push the envelope on the research side of things. And then lastly, we're an area we are not currently working in, but I think could be interesting. We want our offering to be available to anyone who needs it on the patient side. And there are a lot of people who just don't have access or are not currently seeing a care provider for kidney disease. That is, in fact, one of the cruxes of kidney disease, and one of the difficulties we have in reaching people is the awareness is not where it needs to be. So if anyone has an idea of people who might want to learn more about how they can learn more about kidney disease, we would love to talk to them, provide resources, hear their thoughts. And of course, on the research side of things, if there are institutions or organizations who are interested in using emerging technologies in a healthcare application, we are constantly looking for opportunities to partner with those institutions. We have done that extensively. We have received many grants at this point, and we'll continue to use grants as a great resource for helping us to further build our product offering, to expand the number of our product offerings, to increase the amount of evidence we have in this space and applications, and feasibility, usability, efficacy, you name it. So if any of those seem interesting to you, or you have connections, or you want to learn more, please would encourage you. I think you're right, by the way, Eagle, we are in the same AFWERX cohort, which is ongoing. Phase 1 for now. We're all trying to go for phase 2 in the next couple months. Please reach out if you have any questions. It's IKONA.health. I'll put our website in the chat if you have any questions.
And that's pretty cool that you're here and in the same AFWERX cohort. Eagle, same question for you. Ideal client, also existing industries and other industries you're looking at.
Yeah, I think probably because we're in two relatively different industries, I would probably say our ideal client is actually more specific to a particular use case. And the use case is kind of as I laid out, where they have to, the need for training in a particular environment or particular equipment is very high, but access to said equipment is impossible or too expensive, or access to scenarios is impossible or too expensive to replicate in real life. So any, as kind of Tim mentioned, connections to things like the surface warfare school that you mentioned,
Oh.
Suli, and then within like things like the offshore wind space, any of the developers. I know the industry itself is very new for the US, and in general things are still being like settled, but it's always good to connect more deeply within the industry. So any help
You have
there?
an existing contract, right, in offshore wind, or you have some contracts? I have on the here, just to make the introduction on the fly. My colleague William Cotta is here on the Zoom. Thank you, William, for joining. I will absolutely make an intro. If you look in the chat, William, Eagle has dropped his LinkedIn profile. Please do connect, because I think there's some real opportunity there. Eagle, William Cotta is our Rhode Island Commerce offshore wind business development person. So he's a great person to know, and there's lots of opportunity there. So I'll check that box.
Well, there we go.
And then on the defense side, because I know that I did, we talked about that as well. Is it typically contract work, or you have worked with a prime to do work?
I guess we're open to either.
Okay.
Currently we're just like, we are the prime, I guess. So we're
Okay.
contracting directly with the different agencies.
Got it.
So
Great. Excellent. Well, so we have a little bit of time, Amy. And there's so many things that we could talk about. It might be interesting to ask the to panelists where they see themselves in 5 years. If there is another question that you may have of each other, or the audience wants to talk about something like the tech stack, or a business plan and what that might look like, I'd love to hear kind of where people would like to take the conversation.
I'd love to talk about the future, and like as we bring on more hardware, I think
Good.
that'll make it even more adopted. And I just saw a post about Microsoft Mesh and being able to
Yep.
see a full body real time in a meeting with you. I feel like there's so many possibilities, and would love to hear more about what Eagle and Tim have to say about what they think the future of AR and VR as well.
Yep. Yeah. So I would, while they're thinking about their answers, I would say, everyone knows that Apple is also making a play with AR glasses. RealWear out of China is coming into the US. There is a company here in Massachusetts as well that is doing AR glasses. So there are a number of players that are trying to make AR more ubiquitous. Tim and Eagle, where is the future?
Yeah, Eagle, do you mind? I'll just jump in, and then I'm sure we'll go back and forth. So for us, it's exciting because the way that I at least tend to think about our hard roadmap. So I think, obviously we have a 6-month, 12-month, 24-month, 5-year plan, and we kind of throw technologies and ideas on there where we think they might add up, but it's mostly driven by a couple things. Market maturity is a big deal in hardware, right? So we are never going to compete on the hardware side. That's not really our intention. I think everyone kind of assumes there will be consolidation at some point, and not every hardware offering is going to make it. So applications matter. That makes our job somewhat easier. However, I will say where it makes it more difficult in these considerations, especially on the 2-year time frame. If you have spent any time in the VR world, and I'd like to hear Eagle's perspectives here, the last 4 years in VR headset land has been hilariously just cataclysmic for a lot of people. Massive players who have abandoned partnerships, abandoned form factors. We've gone from mobile phones in powering headsets to fully standalone headsets that are tethered to non-tethered headsets, 3DOF to 6DOF, enterprise use cases, licenses being abandoned in favor of gamers. All kinds of crazy stuff is happening. That really affects the companies who are trying to plan, right? So we have to be more, as a growing, fast growing company in the healthcare space, or in any space for that matter, you really have to understand what might happen. Because if you're going to be serving companies, we're a B2B business, we serve enterprises, we have to have an answer and a plan for those kinds of shifts. So on the hardware side, it's, if I'm going to offer and potentially sell 1,000, 2,000, 10,000 headsets into one organization, and only to find out that that headset will no longer exist or be no longer relevant in 2 years, and our content was built for those parameters, that's a tough pill to swallow. So we have to have some flexibility in our planning. So here's, all of that was a preface for me to say, the way that I see things happening is, let's just make a few assumptions about healthcare. It's going to be more virtual. It's going to be more virtual first, more patient-centric, more community-based, extended to the network, more outcomes-based, you name it. A lot of great trends are going to continue down those paths. In that world, how do we want to operate? What role should we play? And that's the important question for us. So the reason we take a multi-technology approach and try to own a disease state in healthcare is because we see the writing on the wall, where great organizations that have regulatory pull are all of a sudden getting excited about software as a medical device and controlling digital health applications. That's unprecedented. This is a brand new burgeoning industry. We have an $18.5 billion merger happens last year, and all of a sudden SPACs are happening once a week. This is kind of the flagpole where, at least in digital health, now all of a sudden there's a path for us all to plan 10 years out, because it's not going anywhere. And we have the backing of regulatory environment. And that really does matter when you're thinking about it, a question like, what does hardware look like in 2 years? So that's a ton of information, but I think of the hardware question, the where will we be in 2 years question, based on what are my operating parameters? What are the key assumptions I can make that if just 2 of them play out, then we're going to be okay? Those are the questions I have to ask. So
100%. I can't tell you how many investor conversations I've been in where a great deal of time is spent in the, okay, so what's happening with this piece of hardware, and what tech stack are you reliant upon, and what's your option B and C? And so many of us have done a bunch of pivots, right, in the last even year and a half, because of acquisitions and companies no longer making bets in certain spaces. So Eagle, what are your thoughts?
Yeah, so Tim brings up a really good point. We as a company have decided to stay away from any VR headset that didn't exist since or VR company that didn't exist since 2016 in terms of hardware. So we only use Oculus, we only use HTC products. We're thinking of moving to Index simply because we know Valve is a very gaming focused company, and they will keep the support for the Index going, probably likely for a while, because mostly just for the gaming. But we've had situations where like Oculus Quest 1, which is a really good step in the right direction in my opinion in terms of freestanding headset. The Quest 1 lost support I think this year, and that was right in the middle of our project with Siemens Gamesa. So that was a tough pill to swallow. And then the U.S. government is also thinking of banning Oculus as a VR headset to be used because no one trusts Facebook at the moment. Everyone is well aware that the moment you put on the Oculus headset, you know, Mark Zuckerberg's team is going to be getting all of your VR data, all of that juicy VR data. So there's that to deal with as well. On a hopeful note, the cool things we've seen are things like the Quest is super exciting because these are standalone headsets that aren't tethered to a computer, which really helps with a lot of use cases, right? It makes it more portable and easier to sell. And then the other thing is haptics. So we've seen gloves, VR gloves with resistance in them. That's been super cool. People are coming out with entire haptic suits now, where you can, like, if you get punched or something in VR, you actually feel it on your body, or like a light pressure. You know, treadmills are also awesome. The Omni treadmill is pretty sick, and so on and so forth. So I think the future for VR, I think VR itself is still going to be kind of niche for a while, but I think like the exciting developments in terms of hardware will probably be the haptics. I'm really looking forward to seeing the new haptic technologies that come out.
And I love to see the merger, right, between AR and VR. You know, you see companies like Spatial working to bring multiple people into a physical space. And then the merging of haptics, so that if I, like, you know, even with your phone, right, I'm sure everyone's tried the strings where you get a guitar for your phone and you play it as a string, and you can really feel it like it's there's a string in your hand. So there's the kind of the merging of so many of these issues as well as challenges in technology. Eagle brought up, and I know that many of the things we're talking about, Amy, is bringing to these events, is the merging of, you know, privacy issues, AI and machine learning on social platforms. Last week we were talking about voice first AI platform, which was really interesting in the esports gaming world. So I see all of these things coming together, but how it's going to happen, no one has that, you know, magic ball. So you know, my last question, Amy, did you have a question that you wanted to ask? And then I have one last question that we before we go.
Yeah, so my question is mainly kind of this, how do you know your business is ready? Like, you know, this I guess is mainly probably for Eagle, but you know, I have a dangerous business. We build some piece that, how do I know that I'm ready for this kind of VR training? And what do you need from me before you can even, like, send out a proposal? Like, what kind of tech do you look for, or preparedness do you look for from a company?
Yeah, it's a really solid question. It's what we've seen is they usually think about the problem has to be acute, in the sense that like a business is ready if they meet a lot of the kind of problem criteria we identify. And the only way we did that is, and this is part of the Blue Swell program, which I highly recommend different startups apply to if you're doing ocean related innovation. But you basically just have to talk with a bunch of these companies. Like, you need to talk to like 100 people at minimum who work within the industries that you're looking into, because you're able to quickly pick up on different things as to, like, knowing if they actually have the problem, and if they're thinking about it. And oftentimes they won't think about VR as the solution, but they will have the problem. And what I mean by that is, if, for example, you know, let's take offshore wind, a hallmark of a company that would be a really good fit would be, you know, one that has a large workforce that you need to train or prepare for or make. And they have to work on, you know, heavy industries or equipment that is not accessible, right? So if we see those two hallmarks within the company, we have a pretty good idea of how that conversation is going to go. So I'm not sure that answers your question, but coming from a startup perspective, it's just talking with a lot of people and then hearing them repeat the same problems over and over again. So you
I
nail.
think
Maybe Amy, and I would love to hear Janice and Tim talk too, because it's a great question, is if you have a training challenge and it has to do with confidence, hard to simulate situations, retention, decision making. I mean, those are some of the things that we learn for that VR might be great application for. So Janice, Tim, did you want to add anything?
I can jump in real quick and say, I think for small businesses and nonprofits, or those with smaller budgets especially, coming up with a pilot or thinking about how you can get a little bit more funding to do something that can prove and kind of assess what the outcomes are from a test. I mean, I think that's the way to kind of get started. And often in kind of business or decision making or communications, you need to have different modes of learning and different ways of communicating. And I do think having a full body way of putting someone in a room with you, making people get up and walk around and not just sit in front of a screen during digital learning, these are all outcomes that we can show how it's impacting learning and training. So again, for startups that want to try it, or a small college that might want to do something, let's get a little bit of budget, show the results, and from there build a larger program.
Yeah, Suli, can I just have 30 seconds here? Does that
Go for it.
I would caution, the biggest issue I've seen is in working with people to get something built. I think there's not enough taking advantage of an opportunity to use a completely new medium. So too many people are thinking about just taking the real world and putting it in VR. That misses the point, right? Like you're kind of, now all of a sudden you're operating under the same exact framework that got you to where you are now. So it's great to use VR for that purpose. It solves a lot of issues, but also think about ways that you can use this brand new wonderful medium in creative ways. And that often handcuffs the creative process of building a new training environment. So it's important to have someone in the discussion who really understands why having X, Y, and Z data and not just XY data is a huge mind opener. And there's things you can do in VR that you cannot do in reality, which is the real opportunity.
Yep. Superpowers, for example.
For one example, yeah.
Tim makes a very good point, and as well as Janice and Eagle, by answering the question with, it starts with that challenge. In order to know that you're ready, come with the challenge, bring to the creative table people that understand VR. They will be able to do things. And I did a Google sprint with Brown 2 years ago now, where we used VR to create a situation that you couldn't create in front of your therapist, right? So you're never gonna, so we basically condensed time, right? We took something that usually happens at night and made it happen at 10 a.m. in the morning, right? But that person with the challenge didn't have that solution until we had in the brainstorming group folks that understood AR and VR, as well as people that understood the problem and the customer. Does that answer your question, Amy?
it does, and it's
Okay,
really
great.
key, I think, to kind of knowing how now innovators that are facing problems are going to approach kind of the new tech, and I think it translates across industry. I mean, across industries, not just, thinking about 3D simulation and training, but other new forms of technology that come out that can support training and development in different ways.